the time with the honourable member for Cumberland-Colchester. Mr. Speaker, after 8 years of this Prime Minister, everything feels broken. Life costs more. Work doesn't pay. Housing costs have doubled. And our Prime Minister divides to control the people. Worst of all, crime and chaos, drugs and disorder rage in our streets. Nowhere is this worse than in the opioid overdose crisis that has expanded so dramatically in the last several years. The Prime Minister has a theory, backed up by a group of activists, most of them tax-funded, pharmaceutical companies, and others who stand to gain from perpetuating the crisis. The theory is that if the government provides powerful heroin-like drugs that are uncontaminated, that addicts will no longer use more deadly fentanyl, and they will practice safe drug use, and we will no longer have overdoses. So the Prime Minister has spent $78 million on 28 projects giving out free drugs. His recent budget proposes another $100 million for more tax-funded drugs. Mr. Speaker, this includes heroin dispensary machines where people can walk up, press some buttons, and heroin pops out. It also includes prescriptions that allow people to take the hydromorphine out into the street and use it or sell it however they like. Now, the theory is that this will divert away from more dangerous fentanyl. Let's look at the facts. Fact number one, since the Prime Minister took office, there have been more than 34,000 apparent opioid overdose deaths. Fact, this is not a problem that the Prime Minister inherited. It is one that he helped create. A total of 5,360 apparent opioid overdose deaths occurred from January to September of 2022. This is approximately 20 deaths per day. It is a 173% increase from 2016, the first full calendar year he was in office. In other words, since his policies have come into effect, the overdose numbers have nearly tripled. Fact number three, while the deaths have risen across the country under the Prime Minister's policies, they have been the very worst in those provincial and municipal jurisdictions that have most enthusiastically embraced them. For example, in British Columbia, where in most jurisdictions, particularly Vancouver, all three levels of government have endorsed the so-called safe supply and decriminalization of hard drugs, the levels of overdose deaths have been the highest. Across BC, the number of overdose deaths are up 330%. The COVID excuse no longer works, Mr. Speaker. Fact, despite the claim by supporters of handing out and decriminalizing drugs that COVID was to blame for the crisis, what we have seen is that as COVID moves more and more into the rearview mirror, the overdose deaths actually increase. For example, in March of this year, we had 9% more overdose deaths in BC than in March of 2022, and 23% more overdose deaths than in March of 2021. So more we move away from COVID, the more the overdose deaths increase. In fact, the deaths are not coinciding with COVID, they're coinciding with the recent decriminalization of crack, heroin, fentanyl, and other hard drugs on January the 1st, 2023. Now, we're told that all the experts agree, just like Liberals tell us all the time, whenever they do something that defies common sense. Remember, all the experts agreed that printing money wouldn't cause inflation right before it led to a 40-year high, or that catch-and-release bail would not cause crime right before crime rocketed 32%. And we're told that giving out and decriminalizing hard drugs would reduce drug overdoses. These so-called experts are typically pie-in-the-sky theorists with no experience getting people off drugs, or they're members of the misery industry, those paid activists and public health bureaucrats whose jobs depend on the crisis continuing. Actually, the real academic scholarship is clear if the minister would even bother to read it. A thorough study by dozens of doctors and researchers from Stanford University, published in The Lancet and chaired by a former advisor to President Obama, found, and I quote, "At the same time, evidence clearly shows the folly of assuming that population health inherently improves when healthcare systems provide as many opioids as possible with as few possible regulatory constraints. Policies that should attract skepticism include the dispensing of hydromorphone from vending machines and prescribing a range of potent opioids and other drugs, benzodiazepines and stimulants, to individuals with opioid use disorders in the hopes of creating safe addictive drug supply and eliminating the supervision of methadone patients, i.e. converting the system to unmonitored long-term prescriptions on a take-home basis." And the study goes on to comment on this claim that hydromorphone is safe, because that's what the government is giving out. Although expressed from a public health point of view, these messages echo the opioid manufacturers in presuming that unrestricted opioid provision can only improve public health. The faith of some advocates that opioids are safe as long as they're not derived from illicit markets is impossible to reconcile with the hundreds of thousands of overdose deaths from legal pharmaceutical-grade opioids that preceded the introduction of fentanyl into the U.S. and Canadian heroin markets. Furthermore, the Safe Supply Program uses this hydromorphone, which one study published on pharmacology, in a pharmacology journal, said is similar, subjective, and physiological in its effects as heroin, but it is more potent than heroin. This is the stuff that that minister and this Prime Minister are giving out with your tax dollars, Mr. Speaker. In a 2020 podcast, Dr. Mark Tyndall, one of Canada's earliest safer supply advocates, said that he had tested the urine of 15 patients who were on safer supply and found that 90% of them used fentanyl. In other words, they were not being diverted from fentanyl, they were using it in conjunction with fentanyl. And now we know that it's even worse than that, that the money is, that the hydromorphone is being resold by the user to children and the profits being reinvested in buying fentanyl. In other words, this government is not only giving out dangerous hydromorphone, it is actually in effect giving out fentanyl by giving the user the hydromorphone to sell and raise the revenue to buy the fentanyl. This government is using your tax dollars to give out fentanyl on our streets and cause this crisis. Meanwhile, the cost of a hit of this hydromorphone has dropped by between 70 and 95% to roughly $1 a hit because the government is effectively paying for it and handing it out far and wide. Mr. Speaker, this makes no sense, and the facts and evidence disprove it as a strategy. This is a radical and out-of-touch approach that is not aligned with any other successful jurisdiction in the world. It is quite the opposite of what they're doing in places like Portugal, which have focused on recovery, not on handing out free hard drugs, Mr. Speaker. And therein lies the hope. We can turn the hurt the Prime Minister has caused into the hope that Canadians need. In Alberta, where they are thoroughly rejecting the decriminalization and tax-funded handout of hard drugs and instead putting the money into recovery, we have seen a 30% reduction in the most recent data in the number of overdose deaths. And that is because it is clear what people who are suffering from addiction need is help getting off the drugs. And to have that, we need recovery communities where they can go, have help with breaking the addiction. If necessary, a little bit of medication to relieve the side effects of getting off the drug, and then have the psychotherapy that is necessary to overcome the underlying reasons that they got into drug addiction in the first place. We know this works. The evidence backs it up. And so our common sense plan is to take the money away from subsidizing heroin-like drugs and instead put all of that money into recovery and treatment to sue the powerful pharmaceutical companies that helped cause this crisis so that we can take the proceeds of that lawsuit in order to fund even more recovery. Mr. Speaker, that is how we are going to bring home our loved ones drug-free. It is how we will turn hurt into hope. It is the common sense of the common people united for our common home, your home, my home, our home. Let's bring it home.